Hello everyone, my name is Yohanca Diaz and it is a pleasure to be here with you today. I am going to present a paper entitled An Analysis of Apps with a Medication List Functionality for Older Adults with Heart Failure. Evaluation using the Mobile Application Rating Scale, or MARS, and the IMS Institute for Healthcare Informatics Functionality Score. I am a postgraduate research student at Dundalk Institute of Technology in Ireland, and I am based in the Netwell Casala Advanced Research Centre. At the centre, we primarily create new ideas to enhance the quality of life and well-being of older people and those who care for them. And we do this through more integrated community-oriented services, more sustainable home design, and more age-friendly technologies. I am also part of the Eastern Corridor of Medical and Engineering Centre, or ECME. This is an European Union cross-border research centre in cardiovascular medicine. It is a collaboration among educational institutions from the Republic of Ireland, Northern Ireland, and Scotland. The goal of ECME is to create new models of cardiac care to improve clinical outcomes and patient experience. So before I start presenting, I would like to provide the background of this paper. As part of my PhD studies, I conducted field observations on a very busy heart failure clinic in 2019. The primary objective of the observations was to get a sense of how the clinic operated and to identify a technological intervention to support healthcare professionals delivering care. During my observations, one of the challenges faced by healthcare professionals involved the medication review process. Patients at the clinic were actively encouraged to bring the current medication or an updated medication list. However, some patients failed to bring their medication or the updated medication list, and this in turn negatively impacted the ability of the healthcare professionals to complete consultations in a safely and timely manner. Managing the care of older adults with heart failure largely centers on medication management. Now, for those in the audience that might not be familiar with what heart failure is the inability of the heart to pump blood efficiently around the body. For healthcare professionals, the goal is to keep patients at the highest medication dose the patients can tolerate, and we do that to improve their quality of life. A correct medication list optimizes the medication review process and avoids medication errors, ad hoc clinic visits, and rehospitalization. So looking at the frequent medication or dosing changes, I thought that an app supporting patients to keep an up-to-date list of medication could be advantageous. Hence, this review focused on evaluating apps to support heart failure patients. I have to add that this review was timely, as during the COVID-19 pandemic, the medication review process took place virtually, a few consultations, or by phone, most of the consultations. Now, I would like for you to imagine for a second conducting a medication review by phone, where patients are trying to pronounce the name of medications to no avail. So one could argue that an app supporting the patient to share the medication list, be it by email or a message, with the practitioner prior to the consultation could support the clinic efficiency. So the objectives of this review were twofold: to review apps with a medication list functionality and to assess the quality of the apps included in the review. And to do this, we use two scales: the Mobile Application Rating Scale, or MARS, and the IMS Institute for Healthcare Informatics Functionality Scale. So a bit about the methods. A systematic search of apps was conducted in June 2019 using the Google Play and iTunes app stores. The purpose was to identify apps with a medication list functionality. Inclusion and exclusion criteria were applied. So those apps that met the inclusion criteria were downloaded and evaluated by a team of 4 researchers. The MARS was used to assess the quality of the apps, whereas the IMS functionality score was used to evaluate the functions present in the apps. A Google Scholar search of the apps included in the review was conducted to identify if any of these apps have been evaluated previously and or published in peer-reviewed articles. So we're going to look at the rating tools now. So the MARS was developed by a team of researchers at the University of Queensland in Australia, and it was developed to provide a systematic means of assessing, classifying, and rating the quality of mobile health apps. Within this framework, apps are rated according to 4 objective measures: engagement, functionality, aesthetics, and information quality, and 1 subjective measure or satisfaction with the apps. So in this table, we can see a description of the MARS items and subscales. So if we take engagement, for example, engagement involves determining whether the app is fun, interesting, interactive, and well-targeted to its audience. Functionality assesses whether the app is easy to learn, easy to navigate, and flow logically. The aesthetics category evaluates the graphic design, the overall visual appeal of the app, and the color scheme. The information quality involves evaluating whether the app contains high-quality information from a credible source. And the subjective quality reflects the user satisfaction, app endorsement, and the continuity of use. What the user thinks. Are they going to continue using this app? The second rating tool, the IMS, was used to complement the MARS quality assessment. But unlike MARS, this tool only assesses objective quality of the apps. The evaluation concentrated on the app functions and the potential role each functionality plays in supporting self-management for patients with heart failure. The functionality score consists of 7 functionality criteria and 4 functional subcategories. So in this table, we can see the functions. So if we explore a little bit, like, for example, inform, does the app communicate effectively to users? Does the app offers an educational component about the medication they are taking or the medical condition associated to each medication they are taking? Whereas instruct, is the app intuitive? Does it provide clear instructions on how to enter the medication strength, for example? Does it provide clear instructions on how to set up medication reminders? And so on. So the scoring criteria. If a function was present in the app, it was coded as 1. If it wasn't present, it was coded as 0. So a functionality score ranging from 0 to 11 was generated for each app. So now I will provide a summary of findings. Both app store searches identify 483 potential apps, 292 from the Google Play stores, and 191 from the Apple stores. So 6 apps, 3 across both stores, met the inclusion criteria. So 4 out of the 6 apps reviewed achieve an acceptable quality, 1 a good quality, 4 out of 5, and 1 a poor quality, 2.5 out of 5. The overall subjective quality dimensions was significantly lower, 2.8 out of 5. As stated earlier, the apps were rated according to 4 objective measures: engagement, functionality, aesthetics, and information quality. The functionality dimension achieved the highest score, 3.7, whereas the information and the engagement dimensions resulted in the lowest, both of them 3.2. In regard to the IMS functionality score, 2 apps achieved the highest number of functions, 11, whereas 2 apps achieved the lowest score, only 5 functions. So all apps were assessed using MARS, and features included in most apps reviewed were the ability of medication reminder, medication history log with the ability to share a medication report with others, and syncing the account to other devices. Only 1 app, MediSafe, achieved the highest objective and subjective overall MARS score. One of the distinctive features of this app, MediSafe, was the ability to educate all users on how and when to take their medication, drug-to-drug interaction information, and medication side effects. And I have to say that the information presented, particularly in this app, the information was presented in very nice videos using a clear and concise language and a very nice and neat text format. So the IMS evaluation and implications for heart failure patients. Most of the people diagnosed with heart failure are over 65 years of age and over. And here I'm going to engage on a debate now about the digital divide and how the people use or do not use technology. But in my experience, with all those heart failure patients that I've been in contact since I started my PhD, I have to say that my experience is that they do not feel comfortable using technology. So all the apps that were evaluated using the IMS, all the apps have a collecting, sharing, and recording functionality. However, half of the apps do not provide clear instructions on how to enter medication, and that's not very helpful for older people. Half the apps do not display vital parameters in an easy-to-understand format. Half of the apps do not provide users with advice on how or when to take their medication, which in this case, I don't think is very useful for older people. So this in turn could impact negatively the adoption of mobile health or apps by older people with heart failure. Finally, only 2 apps have the capability of allowing users to communicate with healthcare professionals or family and friends in real time. App use is growing at an exponential rate, but there are questions about their efficacy. So one of the methods used to check evidence of efficacy is to conduct a search for academic peer-reviewed evidence. For the purpose of this paper, a search was conducted for each app in Google Scholar to identify any published peer-reviewed article. 3 of the apps reviewed were identified in the search. The MediSafe app has been previously tested in 2 randomized controlled trials. My Therapy app was tested on a medication tracker and reminder study, and the DoseCast app was included on a MARS review on a feasibility medication adherence experimental trial. So from all the apps, they were the only ones that we found evidence or peer-reviewed evidence. So just to conclude, the quality of the current apps with a medication list functionality varies regarding their technical aspects. Most of the apps reviewed have an acceptable Mars objective quality. However, the subjective quality or satisfaction with the apps was poor. To our knowledge, this is the first study using the Mars tool to assess the quality of apps with the medication list functionality available in the Irish app stores. The need for an app to support older adults with heart failure to keep an accurate medication list is warranted. So this slide is to acknowledge our funders, the European Union Interreg VA program. And this is the end of my presentation. Thank you so much for listening. Now I will answer any questions.